into getting to India, we underwent several investigative processes, MRIs, Doppler tests, and scans, and then that determined that there was a blockage across the major artery on his left thigh, which needed intervention as well. So, which led to a surgical bypass on his leg, and from there onwards, he's been able to walk fine. So, originally the problem he's been facing for the last 2 years, he's been soreness across his left leg. So he could not walk properly. He could barely walk 50 meters, and after that he used to stop, try and get his strength back, and then start working. So initial consultations and investigations was led to believe that there was claudication on his legs, and that is the reason why he couldn't do that. So which meant that further investigation and some work needed to happen. So in consultation with Medivisor, we spoke to Dr. Vaibhav Mishra from Max Specialty Hospital or Super Specialty Hospital, and upon getting to India, we underwent several investigative processes, MRIs, Doppler tests, and scans, and then that determined that there was a blockage across the major artery on his left thigh, which needed intervention as well. So, which led to a surgical bypass on his leg, and from there onwards, he's been able to walk fine. Dr. Vaibhav was very good in terms of explaining what the problem was. He took us through the process on what needs to happen. He showed us what the scans look like pre and post surgery, as well as making sure that we exactly knew what was happening, what the time frame for recovery was. Any further follow-ups and consultations that were needed was well organized, and he was there to help and assist and sort of explain to us what needed. That's the process that we went through. Like I said, again, very happy with the process, very happy with the service of both Medivisor and Max Super Specialty Hospital.
I'm Vasan from Suva, Fiji Island. I've been sick for past. So meanwhile, I checked in Fiji, in most of the hospital here. Their Heart International, all the places, they couldn't rectify the right sickness of my leg. So somebody told me that Medivisor, to see them alone and do the Eradicates, and my son took over from there. He met Medivisor and he did everything. So he arranged, we flew over to India. They picked us up from the airport, put us on the flight to stay, and the next day brought us back to the hospital. Did all the things. Next day, on Monday, I was admitted, did all the things, and I had my surgery done. I'm feeling far more better than what was there before. And at the moment, I feel better and better and better.
So when we heard about Medivisor, we spoke to Sushant, and our multiple calls, Sushant helped us understand what the process was, what needed to be done, and then initially and originally organized a video consult with one of the cardiovascular surgeons at Max Hospital as well. And from there, we knew exactly what was to be done and what needed to be done. Flew over to India, was picked up by Deepak at the airport with a nice, friendly, smiling face. We were greeted very well, and then driven to the accommodation at the Medivisor house. And from there onwards, all the appointments and consultations were pre-organized. All went well. Hospitality is second to none. Services is second to none. And very happy with the service provided by Medivisor. And some staff, just to name, Ankita has been really helpful and well organized and helped us really well. Deepak's been around helping us, checking us, and then Ranveer's also been helping us, keeping an eye on what's happening, how the progress is, and then overall Sushant as well. So very positive experience. Highly recommend Medivisor to anyone else who wants to have any medical treatments done in India. Very organized, very cultured as well, and they'll also look after you, help out in any sort of questions you've got. To the point, they'll guide you where you need to go to get some groceries. If you need to look around a bit as well, they'll help you out with that. But all in all, a 5-star service. Thank you.